Early childhood development is a multidimensional concept, which means different things for different people. From Thrive's perspective, we want to look at it holistically, ages from conception to age 8. We focus on health, nutrition, early learning, responsive caregiving, and child safety and security as drivers in the child development process. In terms of outcomes, we look at things like health, nutrition, cognition, and socio-emotional development.
We know that early childhood interventions can be very effective and have persistent, large effects on a multitude of outcomes. What we don't know is how to adapt these models to be able to implement them at scale within the tough constraints of the poorer countries.
Scale-up by itself is a science. It must be planned. We must look at the factors that enable it and how do we give it the best possible chance of success. We have to influence policy, and policy thrives on evidence. And I believe that's the gap that Thrive will be able to fill. Where there is anecdotal evidence, it's an opportunity to test it and be able to provide policymakers with the information that allows them to confidently make policy choices, and in particular invest the limited resources that the country has, because they know that this is backed by science, this is backed by evidence.
To find out more or support this project, get in touch.
Welcome everyone. I'm Susan Walker, Professor at the University of the West Indies in Jamaica and a Research Director at Thrive. Thrive is a multi-country program on scaling early childhood development services in low and middle income countries, with a focus on 5 countries: Bangladesh, Ghana, Sierra Leone, Tanzania, and Kiribati. The program is funded by the UK's Foreign, Commonwealth and Development Office, and our work in Kiribati, which you'll hear about today, is funded by MFAT, New Zealand's Ministry of Foreign Affairs and Trade. So thank you for joining our Thriving Conversation series. As you heard in the video, we still face major gaps in our understanding of how to move from successful ECD interventions into scaled programs in national systems. The aim of our series is to help to bridge these gaps by creating opportunities for researchers and policymakers to talk to and learn from each other. Today's webinar features our work in Kiribati, led by Professor Sally Brinkman. Sally has worked in Kiribati and several other Pacific nations for many, many years. Her research focuses on improving the healthy development and early learning of young children in disadvantaged communities. She's a leader in global child development measurement and works closely with communities and governments to generate evidence to inform policy. Her work combines population-level monitoring with pragmatic randomized trials, which combine to help us to understand inequalities in child outcomes and evaluate their impact and cost effectiveness. Today, we'll learn about population-level monitoring through a repeat census of early childhood development in Kiribati, together with reporting back to communities and the role that has played in stimulating government interest in early childhood development. Welcome, Sally. We're also joined by Joan Lombardi. Joan is an adjunct professor and principal advisor at the Stanford Center on Early Childhood, Stanford University Graduate School of Education. She's also a senior scholar at the Thrive Center for Child, Families and Communities and co-founder and senior advisor with the Collaborative on Global Children's Issues at Georgetown University. Welcome, Joan. We'll begin today with Sally's presentation and then move into our conversation. Today's conversation will allow us to learn more about the development of a population learning system involving a wide range of stakeholders. Following this, we'll have time for questions. Please post any questions you have in the Q&A tab. If you have comments or reflections that you'd like to share, please post these in the chat tab. We'll try to address as many questions as possible, but all questions, comments, and feedback will be read by the Thrive team and will help to inform future events. Finally, we are recording this event, and the recording will be available on the events section of our website, where you can also find recordings of previous events. So I'll now hand over to Sally for her presentation.
Thank you, Sue. So today I just really wanted to try and highlight something more than just around child development instruments, more about how you use data and how you use the data collection to create what I'm starting to call a population learning system and how you develop that. And we'll use Kiribati as the example under the Thrive funding. So I suppose just to kind of get started, when we think about the last sort of 40 to 50 years, there's been quite a lot of instruments developed around early child development, and increasingly more in the last sort of 10 to 15 years. It initially started in the 80s with very much of a focus around sort of pediatrics and a very clinical focus, individually assessing children for developmental milestones, early disabilities and delay. Then we tended to kind of progress into more of a program focus. So this is when we were starting to do early interventions in early child development and wanting instruments to be able to measure and evaluate. Then we started thinking about how we start monitoring child development and looking at household surveys. And of course, then we start thinking about the shift from the Millennium Development Goals to the Sustainable Development Goals. And many of us, I suspect many in the audience today, were part of the real push to try and make sure that early child development was represented in the Sustainable Development Goals. So that was successful, and it sits under SDG 4.2. And with that was a whole lot of emphasis on how we start monitoring at a global level. So that's where we see things like the mixed CCDI start. But more recently, we've had the World Health Organization GSED instrumentation, the Global Scale for Early Development, and others. What I think we're now really starting to turn towards is really how do we then use some of these instruments and embed them into systems? How do we make sure that governments are not just reporting at the global level, but that we're able to provide data back to communities and start to kind of think about how we use the data collection method to mobilize communities. This really kind of started originally in Canada with the early development instrument under sort of titans in our field, I would say. So the Clyde Hertzmans, the Dan Offords, the Fraser Mustards, who many of us have kind of progressed their work, but that was really where it originally started, with this idea of population monitoring, where you're giving data back to communities and to start to try and mobilize communities. For the Kiribati example here, we use an instrument called the ECI. I don't want to concentrate too much on the instrument because we're really trying to talk more about the process. There are a couple of key things that I think about the ECI that is probably important, just in that it helps facilitate this population learning system. Some instruments are not so easy to be able to sort of implement in this way. So originally, when we first designed the ECI, it was undertaken in Tonga, done in not just partnership with community, but it was developed by community, with community, for community. So it represents really what was considered by the stakeholders as such to be a strong Tongan child. What do they want their children to look like when they're coming into the school environment? What aspects are you wanting to see? We started with the intention that we wanted the instrument to be free, easy to use, so it was pragmatic, locally owned, engaged communities, that it was sensitive to change so you could monitor over time, and it would meaningfully detect changes at both the policy level, sort of across the country, but also at a community level. And most importantly, it was designed with reciprocity in mind. So how do you collect information in a way that you can then feed data back? Since that time, it's been used in lots of different countries because it's freely available. I'm sure there are other countries that have used it as well. These are just the ones that I know where it has been. Some more specific aspects covers an age range from 3 through to 5. That's important because it's that transition from sort of the early childhood health into the education system. How do we ensure that children are coming into the school environment ready to take advantage of the school learning? Importantly, it's not just like a pediatric instrument which just measures developmental delay and whether children are meeting their milestones or not. It also tries to capture children's strengths and their capabilities. This is really important when we're trying to engage multiple agencies. We're not just trying to engage health, right? We're in early education, we're here to try and improve children's development, right? We're not just trying to prevent delay. So it's important that it has those aspects of both delay and capabilities. It also means that when we're presenting data back to communities, we can take a strength-based approach as well. Holistic captures a whole lot of different things. In Tonga, we included, things like reciprocity, loyalty, humility, aspects that are really important in Pacific communities. And that's why other countries in the Pacific were really keen to utilise it as well. So when we started the Thrive research, Kiribati had already expressed an interest in being able to undertake the kieki. They had done it once before, back in 2016 under World Bank funding, and then they wanted to repeat it. And we tried to bring that in underneath Thrive. But importantly, we made sure that the funding was supporting not just the data collection, but also the presentation of the data back to communities so that we could try and create this sort of intervention in its own right in presenting the data back to communities. I won't go on further with all those different aspects. This is kind of the life cycle that we think of when we're using the ECI in different countries. So generally the process on is that, you go through this process of contextualizing the tool, making sure that it's adapted to local country and context. Each country is different. The Kiribati instrument is different from the Tongan instrument. I would say about probably 90% overlap, but there is definitely a difference between the instruments. And that's the same in every country that it's utilized in. So it's not just a matter of translation. Collecting the data, the way we do it is we tend to try and really engage people from the local community that we then train to become enumerators, and then those same enumerators are then also trained in community dissemination so that then they present the data back again. We analyze the data in a way that we can present the information in maps. So you can see the little geographical map there. That's just one of the islands in Kiribati, Avamana. And we tend to use a traffic light system. It can be whatever colours that people are interested in. In Kiribati, there are no traffic lights, but still green, yellow and red seemed to be okay with everybody. And so that's the sort of the colour system that we use. But again, that's just a conversation with community in terms of how you map the data back. Every community gets some data, so then you're able to engage back at the community level. Information is shared. We tend to do a lot of community mobilisation around the results through the mapping. So we go back out to every community that we collected the information. We go back to every single one, and we present the data back again. And we provide information around how you can think about early child development, what you can do to support early child development. And we start having discussions around why the community might be seeing the results they've got and what they might be able to do to be able to support children's development. Importantly, we present maps for every one of the different developmental domains. So communities will always tend to be doing better in some domains than other domains. So again, when you're talking to the community, you can take a strengths-based approach and you can say, well, the community seems to be really supporting these aspects, but not those aspects so well. What might be working well in some areas and not so much in the others. And then there's the whole life cycle where we repeat and then monitor over time. So one thing that is really important, if we're trying to think about this sort of learning cycle, Many of us in early child development instrumentation, we talk about individual diagnostic instruments and population measures. I think sometimes that's not helpful. um, Individual diagnostics are not all the same and population measures are not all the same. And it's not just about the instrumentation and the items within the instrument or how long the instrument is. It's also thinking about the process of how you utilize the information and how you do the data collection in the first place and how you present the information back and what you're trying to get out of the data collection. So most population measures in early child development are used as a representative sample, put into a standard household kind of a survey, and you do a representation of that region or country or whatever you're sampling from. That information then tends to be put into reports, presented to government, and that's totally important in its own right. But if you're trying to get the community engagement, I would advocate for more of a census-based approach, or at least near census approach, where you're really trying to get every child included, every community is then represented, and then you're able to do the community level engagement right through to the political as well as, right? So you're being able to capture the whole lot. Granted, this is generally a more expensive way of being able to do data collection, and it's a different way of thinking, but what you get out of it is completely different as well as. And I think it's probably more helpful not to think about it as just a data collection exercise, that we are thinking about it as a population learning cycle and that we're mobilizing communities around early child development. And the instrument as such is just a tool to be able to help make that happen. And it's the process of the collection that really creates that intervention in its own right. This is when we do the ECI, we also take heights and weights, so we're able to take stunting. This is just an example of how we utilize the data when we go back into communities and start to disseminate the data. These are two different islands in Kiribati. One's Maracay from the North Gilbert Islands, and then Terena is part of the Line Islands, so further south in Kiribati. You can see that they've got each of the communities in these islands got quite different results, with Maracay seeing higher stunting prevalence rates than in Terena. Still in Maracay, you've got one community that was green, and in Terena, you've still got one community that is red. So, you still got variation that you can talk about within the island. One of the things that we try and do is get to match with other data. So, for example, for this, we thought it was useful to look at other census information that was available in Kiribati. And even if you're just looking at sort of some of the different habits of the households and whether they're participating in raising sort of chickens, livestock, growing their own crops, whether they're out fishing or not. And you can see quite a difference between Maracay and Terena. And we don't know whether that's a causative relationship in terms of stunting, but we expect that it has some relationship. And again, it's just this prompt of the conversation in the community to start talking about early child development, raising the awareness of the importance of child development, and then things that the community might be able to do to try and support improving early child development. So if we think about just kind of the different ways of doing sort of population monitoring, you can kind of think about it as what I would call a traditional sort of surveillance system, or what I'm kind of trying to advocate for, which is more thinking about population learning system. If you have the data at all of these different community levels, then you're able to clearly aggregate up. You can still do your national reports. One thing that's important within the ECI is that we actually included the mixed ECDI items. So it means that even though you're collecting across the entire country, you're getting every single child, we're also getting the ECDI, which means that we can still report against the SDG 4.2. So it's doesn't need to be an either or, it doesn't need to be an instrument war. You can, kind of combine the efforts and be able to do both, right? Doesn't need to be an either or type of a situation. With that information back at the community, it means that health services can engage in their service provision, they can look at resource allocation, schools and teachers can sort of see what the next set of kids are going to be looking like coming into their school system, they can get prepared for that. At a community level, you're able to engage parents with the maps, really easy to understand, really easy to start a conversation with. And then clearly at the political level, that's easy because you can bring the reports together and present those reports back. So you just kind of trying to maximize the public value through the process of the data collection. These are just some examples in Kiribati that we undertook when we were doing the Thrive research. So when we started, before we commenced doing the Kiaki, in Kiribati there's a National Research Coordinating Committee. We presented and discussed with the coordinating committee the plan to do the Kiaki again. That committee is actually chaired by the Office of the President, so we were immediately getting sort of political attention as such. The Ministry for Education was the original ministry that requested that the Kiaki be undertaken again. And so we had that sort of initial engagement right from the start. Importantly, though, when we actually got the data, we presented back to that coordinating committee. We actually undertook training with that committee so that we were able to teach them about how the data was collected, how we analysed the data, how we put the maps together. We talked to them about how the maps could be presented back to community and invited them to participate in all of those different aspects. When we did the training for our enumerators, that training was also opened up to ministries. So some Ministry for Education staff and Ministry of Youth Services also participated in that training, and some actually participated in the data collection because they wanted to see how it went. Those enumerators were then trained again so that when we had the maps, they were also the same people going back out to the communities to present the data. So they were part of that reciprocity and that cycle of, if we're going to collect information, we're also going to present the information back. And that really engaged the community because those connections were already made. We actually were asked to present to the Members of Parliament. Members of Parliament had a special half-day sitting session, and we, along with UNICEF, presented the ECI data. UNICEF presented some of their own results of different data collections that they had done, and we had the MPs there throughout that half day talking about early child development, which was pretty impressive. So partly that was because we had presented to the National Research Coordinating Committee, and the Office of the President was very interested and wanted the MPs to know about the data, particularly because we were going to be going out to all the communities and sharing the results with them. And so, of course, they wanted their MPs to know about what their data in their own communities was looking like. We trained district education officers, DepSecs, right throughout. We were doing training throughout the process and engaging government throughout the process. And I think one thing that was important was that we it was pretty closely where we, in terms of just the budgeting and thinking about the finances, we pretty much allocated the same amount of resources to the data collection as we did to the data dissemination. And I think in most data collection methods, that's very unusual. And I think that's something for us to think about when we're putting our grant applications and things together. If we have this kind of approach in mind, if this kind of approach is attractive to others, then I think we need to think about it right from the start in terms of funding models, and that it not be just seen as a data collection exercise. So this is my last slide, and I suppose I just kind of wanted to conclude with, kind of a suggested framework for thinking about a population learning system. I would suggest that if you have that population coverage and if you're able to put maps together and get community data together, then you're far more likely to get ownership. You're far more likely to get engagement from community through that process. So if you're sort of designing it right from the start in what we would call data sovereignty, then, you know, the sort of communities have rights, right? And they have their control and some confidence, not just in how the data is collected, but then when you come back and you present the data, because they've been engaged in the process and they were part of it, then they're more likely to trust the information and they're more likely to engage with the data. And it's about their kids, right? It's their kids in their community and how does their community compare to their neighbouring community. And that's very engaging, way more engaging than a report where you're sort of, you know, trying to present representative results. You just don't get the same engagement, not at the community level anyway, if that's what you're wanting. That reciprocal dissemination is really important. And so I think it's really this kind of design right from the start around the collection strategy, dissemination strategy, facilitating that capacity building and facilitating partnerships. And so thinking about that continuous learning and improvement cycle. All right, that's it from me.
Thank you, Sally, for that very stimulating presentation and encouraging us with how we can move from data collection to creating a learning cycle with benefits across the society. So we'll move now to our conversation. First, I'd like to ask Joan to just quickly introduce herself and maybe say why she was so keen to be part of this discussion.
Well, thank you, Susan. And really, it's an honor to be here with two great champions from the Atlantic to the Pacific. The two of you have been so outstanding in your work on measurement, on programs in our systems, and to join the whole Thrive team, whose goal is really to help translate the research. And that's what we have to do if we're going to try to reach communities and reach parents. There were two experiences that really drew me to Sally's amazing work. First of all, as many of you know, I've been in the field for many years, over 5 decades now. And in the more recent times, I've been working with the Stanford Center, as Susan mentioned, working on a survey called the RAPID survey, which we started during the pandemic to get a sense from parents themselves across the US of how they were faring with their children under 5. And one of the things that happened during that process is we started hearing from communities that they wanted to do the survey and understand their community and how their parents and their community were experiencing the pandemic. We're doing it now post the pandemic. So this notion of community interest, of building on community strengths, which Sally so wonderfully demonstrated in her presentation, was very similar to what we were seeing when we began to work in communities and really build on community strengths. So that was one. The second was the tracking of early childhood systems. I think we're moving to an era from program to place, and we're seeing more and more communities come together and say, we want to be the best place to raise a baby, and we want to do that across sectors. This kind of measurement is critical. This kind of understanding of what's going on in the community across domains is critical to that. So for those two reasons, I was really drawn right away to Sally's work.
Thanks, Joan. So to continue the conversation, Sally, you talked quite a bit about your community engagement and the importance of reciprocity to communities. I think many people would be interested in learning more about that, about why this is essential, but also not just why. I think many of us would be convinced it's essential, but what does it take to do it well? And what are some of the things, if the researchers were thinking of starting out on this journey, what should they make sure to pay attention to?
Yeah, it's a great question. I think for me, it's kind of time. Time is hard, right? Because we're all so busy and it's, difficult within, especially sort of the funding environment that many of us are in at the moment, to be able to create the time to spend. Um, it's very it's kind of a lot more attractive to be able to just collect data, put a report together, and you write your academic publications in a way, right? Like it's kind of, I don't know, I don't know. I don't want to say sort of simple way out, right? But it's kind of that seems to be the core of what particularly academics and researchers are and how they're funded, right? And what their KPIs are. So it does take quite a dedication and an argument. Like I think we need to build the argument for this kind of approach, right? And it become part of practice. I mean, I have been finding across both Australia and the Pacific, particularly working with Indigenous communities, that reciprocity is a fundamental core of culture. And in the Pacific, if you want to do research well, and if you want to come back into the Pacific and engage over time, then reciprocity is kind of fundamental, right? Like it's just the way you have to do business and the way you have to do work. And I think it's right. And I think, the older I get, the longer I've been working in, in this game, kind of the more I'm really putting that above and well above the academic publications, because that's where you see the action, that's where you see the engagement, that's where we can actually change children's lives by engaging with parents at that cold face, right? We're still trying to engage the policymakers as well as, it's not saying we're not doing that, right? But by really working with community and getting that same community up as well as the top-down approach, if you can try and get them to come together, and if we can actively plan and fund research in a way that engages both of those aspects, then I think we will be doing better as researchers. I suppose I probably would also reflect that research at the moment is going through a difficult phase right now, right? Like we're seemingly losing sort of trust and respect in society more broadly. And I think one thing that we can do is really actively engage better with communities and show our value and show that we can work with them and we care about them to be able to improve their lives. And that is our value and our intent in the work that we're doing. I don't know. I think it's it's lots of different things.
Yes, that was great. Joan, do you want to add to this perhaps and think of maybe what are the implications and benefits of this approach of partnership between community and researchers?
Well, it's so great to hear Sally talk about the cycle. And, I think as somebody who's worked in the policy circles for a long time, when we have community data, I think the policymakers will listen more to, they're their constituents. So hopefully that will help. The partnerships, I think we're starting to see it change in the way research is done. And this is a great example. I think where we traditionally have been has been separate from community, separate from policy. You have an idea, you have a program, you test it out, you do a random control trial or other type of research on that program, and then you try to scale it. That may be right for some types of efforts, but I think what this is showing us is there's another way. And that way is much more partnering with policymakers or the community from the beginning. And I heard that over and over in Sally's presentation. It wasn't bringing the data after you collect it. It was helping design the instrument. It was getting their feedback. It was training enumerators. So that continuous involvement, I would say we need to integrate that into our university training for researchers. because I think they're trained, as Sally's mentioning, in a more traditional approach that is not as partnering with communities. That's what needs to change. And on the policy side, I think we have to train policymakers to listen and understand research, or what research is doing from the beginning. So this is a reciprocal process, but it's changing the nature of how we value partnerships with communities. And I think we need to give credit to academics that are doing that. And that's what I hear Sally saying.
Yeah, thank you. So Sally, one of the things you mentioned is that you trained enumerators to do the data collection in Kiribati, but you also retrained them to report back, to be the people who reported back to communities. And part of what that achieved was also building resources and capital within the community. So going forward, what are the opportunities? How can we strengthen service delivery for families in these types of small island communities where they may not have many people who have the related skills?
Yeah. Yeah, I mean, I think quite often we forget that enumerators can be family members and community members as well as so so I think that's kind of important that we sort of think of them as part of the community, and so they are also of a value, right? Like it's not just a data collection that they I have to say, they're far more engaged if they know that, this is about their communities and that they can be part of the process of disseminating the information back, like they're far more active in the way that they undertake their work as well. For us, we discovered actually when we were doing the data collection that there is, or actually through the dissemination process, that there are actually a group of people that we were not aware of after working in Kiribati many years. I had not realized, but there is a group of people called island-based inspectors that the Ministry for Education picks up every now and again to be able to count things. So count the number of kids in preschools and schools, to be able to check that the teaching staff have their qualifications, which is sort of like a first aid certificate and a 2-week certificate of some sort. They kind of get picked up every now and again. They're like a casual workforce in a way. And so most of these people were already early childhood educators. So we were able to then use the enumerators to be able to help train these IBIs initially and get them interested in the work. And then we brought them into Tarawa. We used some funding through the Thrive research and managed to get some World Bank money as well to be able to bring them into Tarawa, the main island, to be able to train them fully. So we trained them in the Ecudata, we trained them in the maps, we trained them in sort of different pedagogical approaches to be able to support play-based learning both in the home as well as in the early childhood setting. And then we're able, to go back out to their islands. And then we asked whether they would be able to cascade train to other community members, be they other early childhood educators or sort of people that were considered of high respect within the different communities and had a positive engagement with families within the different communities. So that whole dissemination strategy led to sort of this uncovering of this group of people that we were then able to support, because there is no community health nurses, not child health nurses. There's community health, but there's no child health nurses in Kiribati. There's no sort of specific workforce that are there to be able to help support children and young families prior to the education system post-birth. So this was starting to try to think about how do we think about kind of creating that, filling that gap really. Now that this has been piloted, the government's very keen on ramping this up, and we're hoping that it looks like there'll be some World Bank regional funding that we may be able to bring to the table that Kiribati is interested in participating in, and that will provide some funding to continue the work of training up these IBIs.
Thanks very much.
Susan, I just underscore the importance of the communication of the data back. And I think because you've got people involved from the beginning, it makes it easier. If you don't do that, I think then the community questions the data. So it builds a trust right from the beginning. And I think that's so important.
Yeah. So Joan, to continue, I mean, we heard about what's changing and possible in Kiribati. What do you think the implications of the Kiribati story are for other countries, other small island developing states, or even in other regions?
Yeah, I think it's of interest around the world, actually, because there's this movement towards systems. And there's a much more of a focus on culturally appropriate instrumentation and really looking at the ecology of a community and understanding it from the perspective of people that live in that community. There's a resurgence of interest in that. And so the data has to be democratized to reflect that. And I think that's what Sally's showing. When she mentioned the maps, I remember seeing Clyde Hertzman present the maps from Canada, and it just brings it right home. So I think if there are people in the audience that are interested in doing similar things in their communities, and I think communities all around the world are, and some of them are already doing it, I think showing maps, so you show the power of the data and hear about the process and how you involve community. But we need investment in this because this does come with a cost. Sally mentioned it. So I'm hoping that national and local governments can begin to invest in this and see the power of it, and that we can build infrastructure so that this kind of population systems becomes part of the early childhood system as we move from program to place. I think the regional early childhood network can play an important role in sharing this information across the regions and around the world. And I would urge us to work with them to make that happen.
Well, thanks. We're going to have to wrap up the conversation now. Thanks to you both for this really informative conversation, and really for centering, reminding us how much we need to center the work we do around families and communities and their voices. And I think that's a really big, hopefully a big take home from the webinar. So we'll move on now to Q&A. Okay, so for you, Sally, are there any signs about how communities have started to use the information that you've shared?
Yeah, great question. Yeah, so it depends on the community. Some clearly engage more than others, and it tends to be very much around local leadership, of course, and their interests and how you can engage them. But one thing with sharing it broadly is that it means that you're kind of trying to maximize the opportunity for anybody in the community to pick up on it, right? So there are some sort of local leaders that have been very interested and have engaged very deeply in the improving the attendance so like they've picked up that they want to increase in attendance in early childhood education, and that's something that they've really focused on. Some have focused very much on the stunting and the nutrition aspects and areas that they can improve in that. And then there are others who really have taken the tips and tricks that we provided around what you can do at home around enhancing early child development. So when we present the results back, we don't just present the maps, we present information around what they can do at home and different sort of like just simple play-based type of things to be able to stimulate children in the home environment. Some of the both community members through what they call the Manayeba, which is the local community hut in a way, like it's a local community organisation, like a local government maybe, you could liken it to, have picked that up, and then they've created like community play groups to be able to use those different tips with parents. So different communities are sort of engaging in different ways. In some of the other countries that we've utilised, sort of had the same sort of approach. We've had governments, for example, in Tuvalu, that they put a food sin tax on bad foods for young children, and a very strong focus on poor stunting rates. That was one of the things that they really picked up, and when we repeated the cycle, we saw vast improvement in stunting over that time, and it was really put down to the fact that the community mobilisation was so strong that we engaged community, that we saw such a shift in prevalence rates so quickly. So it kind of depends. It's not just one thing, and it's not just one group of people. In some areas, it's been particular donor or aid agencies that have picked up the results and have really run with it in local areas. So they've used it for sort of resource allocation or targeting of where they might work. So very different sort of responses to the data in the different regions.
And I think that variation examples will help people get ideas for how to use it. But what we've found is that you have to be intentional about encouraging the use of it.
Yeah.
And it's not a one-off time. It's a continuing process from the beginning of the idea through the utilization, and it goes on over time. I think that's why Sally mentioned you need time to make this work.
Yeah. So kind of linked to that, Joan, one of the questions is around the whole issue of, I think you mentioned that the part of the approach helps to build trust between the communities and the researchers. But someone is asking about, well, what about if some of the results are very poor, and would that then potentially damage trust with the communities? Or if the communities don't really relate to the findings? So are there sort of challenges around? I think this is really more about how you report back to communities, but I mean, it is a potential danger, I would think.
Yeah, I mean, one of the things that is good about capturing data across multiple domains and being able to sort of present data in that way is it's actually quite rare that you get communities that are poor across all areas of development. So there's always generally something that you can take in as a strength, and you can say, well, this sort of area is doing well, and so then you can start the conversation in that way. So you're at least sort of starting in a strength-based way. Having said that, there are some communities that are sort of red across the board, and then yes, that's a difficult conversation to start with. We particularly had some difficult conversations in Tuvalu with the stunting data. It was very, very poor. And there was a real, we really had to explain stunting and what it was and what it meant and how it was measured. And it was kind of interesting. It wasn't until there was a conversation about how Tuvalu does not do well in the Pacific in rugby in comparison to other countries. And then if you look at the people in Tuvalu versus the people in other countries, then they tend to be shorter on average than other countries. And that was not something that I came up with. That was not my suggested approach, but that was what kind of triggered it. And then there was this discussion, actually, like this is something that we're seeing right from early childhood through to adults, and that, you could see some areas which had higher variety of food and higher access to nutrition. I mean, the other thing is, like essentially, generally, we're talking poverty rates, right? Like it's issues associated with poverty. Communities know that this is, an area that is difficult, right? I mean, nutrition is very difficult to get into the low sandy soils, poor, very poor sort of ability to be able to grow fresh fruits and vegetables is very difficult. So, at that level, it becomes, well, what can be done at a sort of system level to bring in better soils and fertilizers? And there's like a whole broad conversation that starts up. So I suppose it just kind of depends, right? I always think there's a strengths-based way of being able to start the conversation, but at the same time, the maps help in that process and help start the conversation. I always think of it as the data is there to trigger the start of the conversation, and it's only the conversations that then trigger onto action, right? It's like the maps are the mobilizer, they're the engager, they're the way that you build the trust with the community, they're the way that you have that opening to be able to have that discussion with community that you wouldn't normally get. So it's privilege in that way.
I mean, it's a very important question because it does come up. And I think because you start with capability and strength as the opening sentence, but there are issues that come up. I think I've heard communities say, we've always known this. We've always known this. We don't really want to face it. But if you turn the conversation on to what can we do about it? What do you think we can do about it? I think you get action and you get agency, and that may be helpful to the community. But it is an important question. I think we have to train people in how to communicate data in a way that starts with strength.
Yeah. So there's a number of questions coming in, I think, about people are really interested in the process. And so one of them is around how you move from this kind of approach in a small island state through to larger communities, the cost of censuses, all those kinds of nitty-gritty things about how, are there any models for how you would scale the approach if you weren't able to necessarily do a full or a close to approach census. And then there's also been a question a little bit about when you are around, we all know what our ethics boards are like nowadays, how you work around naming communities and, going back to with the maps and so on. So, is that an ethical concern for you, and how have you dealt with that? So those two kind of questions around how we move from this really wonderful approach in the Pacific to, in a sense, taking it and implementing it in other regions.
Yeah. So I mean, we have had a few experiences with this, not just with the ECI, with the Australian Early Development Census in Australia, with the EDI and variations of the EDI in Canada and other countries, and with the ECI in other countries as well. What tends to happen is we generally start with smaller regions. So, for example, in China, right? I mean, very big country, lots of kids. The idea of a census is a little overwhelming, right? So generally in China, we've started with provinces and counties within provinces. And so you sort of start smaller where there's interest, where there's some funding support and some engagement and understanding, generally partnering with a local university. And then if that's done well, then the neighbouring, counties and provinces become interested in it as well, and then they want to do it also, right? And so it kind of grows in that way. In Australia, before we had the national, so we do national child development measurement using the ADC once every 3 years. That started with 200 kids back in 2001, 2002 when we first started it. And then 2009 was the first year that we did a full census across the whole country, right? So it took that amount of time to be able to sort of ramp that up to get to the full national data collection. So started with a couple of hundred, it started with a health service, then other health services wanted to be part of it, other education districts wanted to be part of it, and then it built up, and then the federal government became interested and funded it as a national census. So I suppose be patient, don't necessarily start with thinking full national right from the start. I mean, if you can, great, but if you can't, then I would start in regions and kind of work it up, but be intentional about what you're wanting to see at the end of the day. In terms of the ethics, that's kind of it's a good question, and increasingly we get questions about it. Never used to. So it's good that we've got track record and haven't seen any harm associated with it. I think the worst thing we had was real estate agents actually getting a hold of the data and then wanting to use it to have sort of promote some areas over others. Anyway, that's kind of the worst scenario we've had. But generally, we get consent from the communities, right? In terms of we go into each community, especially in Kiribati, anyway, in the Pacific, we get the local leadership approves, right? So we engage with that community head right up front, and then get that local village head's approval. And then we approach the families after that through the process that the village head would prefer. So however that approach is best done. So the consent is really through both the governance levels, the country governance levels, as well as through the parents and to the education system if it's done through the preschool system. However the data is captured, it depends. Some it's through health, some it's through education, some it's through town clerks, through local councils, if there's no, depending on the age range of the children that we're looking to capture. So again, depends country by country, it's a little bit different.
Okay, that's all we have time for now. So thank you both so much for this wonderful discussion, and thanks to the audience for joining us today.